Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right um, molar region. Now, this is the panoramic view. On the panoramic view, we can see we've got some bone in the region of the 5, and we've got very little bone in the region of the 6 as the sinus has pneumatized quite crestally. Now, on the transaxial view, which is the proximal view, this is the region of the 5. Here we do see bony architecture, and here it is safe to say that an implant can be placed which will have relatively 5 or 6 millimeters of bone ridge with approximately 10 millimeters of bone height. If we move slightly distally towards the molar region, as you can see that the sinus comes down quite significantly, and here even though we've got very limited space because this is with a 7, it is quite mesially tilted. So a sinus lift procedure will need to be done, and 2 implants will need to be placed very close to each other. A relative measurement for you is 6 millimeters of ridge width with approximately 4 millimeters of ridge height, and a additional minimum of 5 millimeters of sinus space will need to be lifted. So this is very important to see as we have a defect in the region of the 6, which is quite significant. But if an implant is placed in the region of the 5, which is exactly right here, we've got 6 millimeters and we've got approximately 10 millimeters of ridge height as well. So we will place an implant and we'll show you what the most ideal implant location is going to be. Now here you can see we have placed 2 NeoBiotech implants. This is the most ideal location because the space is too narrow for 2 implants to be placed at a far apart distance. So this is the minimum distance that we could have given in this region. The 2 implants have a rough distance of approximately 2 millimeters that can be placed. The tooth on the distal aspect, the upper right 7, will need a little bit of a enameloplasty so that a crown can be placed here. Or if it can be orthodontically moved distally and the 4 can be moved mesially, then an implant placement with a more comfortable bone coverage can be done. We will also share an implant planning report. The bone quality in this region, however, is very poor, and both sinus lift and bone grafting is definitely advised in this segment. Thank you very much.